Crepitus. Grating, crunching, popping or crackling sounds heard and felt over the joints during passive range of motion is often called as crepitus. So what are the conditions which are associated with such abnormal sounds? Most commonly, these are associated with arthropathy, examples like osteoarthritis and rheumatoid arthritis, and traumatic conditions like cartilaginous injury like meniscal injury and labral injury, or maybe because of the ligamentous injury, most often due to an anterior cruciate ligament injury. So all these conditions are associated with the development of an abnormal sound called as crepitus. So what is the mechanism behind such sound? So crepitus of the joints is mainly caused when two rough surfaces grind against each other. Examples, if you see the conditions like rheumatoid, osteoarthritis, in both of these conditions, there will be degeneration of articular cartilage of the joint surfaces, creating erosions and irregularity. So both of these conditions are associated with the development of abnormal sounds between the joints called as crepitus. So when two rough surfaces moves against each other, they produce sound called as crepitus, and this is what all of you to remember. Especially if you see in the condition called as rheumatoid arthritis, there will be an autoimmune response and a subsequent inflammation. There will be a release of cytokine and pannus formation, finally causes destruction of the cartilage. But in the condition like osteoarthritis, a repetitive strain with loss of glycosaminoglycans and activation of matrix metalloproteinases is principally responsible for the damage. So finally there will be a damage to the joint, but the mechanism is different in osteoarthritis as well as in the rheumatoid arthritis. So what is the sign value of this condition? Altman et al. Reported that the crepitus had a sensitivity of 89% and specificity of 58%, positive ratio of 3.0 and negative ratio of 0.2 for predicting osteoarthritis of the knee. And remember the point here guys, that the crepitus is common in the patients with osteoarthritis, and crepitus alone has a limited diagnostic value due to its presence in many of the other common disease states.